All right, just a mashup of some antibiotics that are left over. Other cell wall agents, Bacitracin, this is a polypeptide. It's used for gram-positive injection and given peritoneally. It is toxic to the kidneys, so generally it's used as a topical antibiotic. Though it is used in feed for animals, you do have to worry about withdrawal times. Vancomycin, this is a glycopolypeptide. It is gram-positive, and it's used in resistant infections kind of towards the end there, when the other like fluoroquinolones and cephalosporins don't work. It can cause ototoxicity, nephrotoxicity, and pain at the injection site. So it can cause deafness, and it can cause renal issues. Carbempamines, these are beta-lactam. They are bactericidal. The one that you'll see most often is ipamine clastinine. This has the widest spectrum of bacterial activity. Meropeamine, this is also has about the same spectrum as imipamine clinistine, but it is more soluble, and you can give it its sub-Q, and you can give it in smaller amounts. The problems with these drugs are GI upset, pain, and they can cause seizures. So monobactams, this is a beta-lactam. It is bactericidal. They use this for gram-negative, and really this is the drug of last choice. They has a very limited use in animals. It's not used a lot. It's usually actually used in humans more, but you can use it in cases that are extremely resistant. So cell membrane agents, polymyxin B, this is like polymycin. These attack cell membranes. Usually it's used for gram-negative. Generally it's used topically. What you might hear it is called as BNP, so it's bacitracin, neomycin, and polymyxin B. So that's a common topical medication that you might see in a clinic. Antimetabolites, these are sulfonamides. They come from an industrial dye, so they're really not a true antibacterial. They are bacteriostatic, and they use these for coccidiosis as well as upper urinary tract infections, upper respiratory and lower respiratory infections, and wounds. Basically what this does is it blocks the synthesis of folic acid. It is only effective against organisms that produce their own folic acid. Okay, it's metabolized in the liver, excreted in the kidneys. You do need to worry about crystalluria, KCS, which is keratoconjunctivitis sicca, or dry eye. They can be photosensitive, so they need to stay out of the sun. They could have seizures, and definitely food residues, so don't use this in food-producing animals. Sulfadimethazine, this is also called Albon. It's generally used for coccidiosis. It's kind of a common one that they use. Can cause vomiting. It is tetragenic, so you may not want to use it in a pregnant animal. And the last one, nitrofurans. These are bacteriostatic. They're broad spectrum. They use them for urinary tract infections as well as URIs. You do not use these in food-producing animals at all. Nitrometazoles. These are antibacterial as well as antiprotozoal. And the most common one that you'll see is metronidazole or Flagyl. And this is used for Giardia. It's also used for other protozoan infections. And it's used for anaerobic bacteria. I'll tell you pretty much, a dog comes in with diarrhea, we don't find much, they're probably going to say, here, try some Flagyl to see if we can clear that up. You may want to use caution in pregnant animals. It can cause vomiting and diarrhea, as well as CNS symptoms and liver toxicity. Be aware that these CNS symptoms can happen 7 to 10 days after you start using the medication. So if a client calls 7 days and says, my dog is acting a little strange, it seems a little ataxic, and they've been on metronidazole, you may want to have them come in. Okay, you guys have a good week, all right? Bye.